My name is Colin Berry. I'm a Professor of Cardiology at the University of Glasgow, and I work in the Queen Elizabeth University Hospital and the Golden Jubilee National Hospitals. I would like to tell you about the CISCO-19 study, which involves heart, lung and kidney imaging in patients who have been diagnosed with COVID-19. Our study is running in the Queen Elizabeth University Hospital, and we are inviting patients who have attended hospitals in Greenock, that is the Inverclyde Royal Hospital, the Royal Alexandra Hospital in Paisley, the Queen Elizabeth and the Royal Infirmary Hospitals in Glasgow. So we have a multi-site effort to enrol patients who have been admitted and discharged from hospital with COVID-19. The study has been funded by the Chief Scientist Office of the Scottish Government, and we have a fantastic team effort involving research nurses, radiographers, trainee doctors, consultants, laboratory scientists and research management staff, all pulling together across these sites to deliver this project. The project aims to assess whether the heart and lungs and also the kidneys have been in some way involved in the infection of COVID-19. We're using MRI and CT scans at 1 month after hospital discharge to image these organs and to determine whether there is any evidence of inflammation or impairment in function, notably in the heart. The study involves eventually up to 160 patients, including some control subjects who do not have evidence of COVID. CISCO-19 also involves blood samples to assess for circulating measures of heart injury and inflammation, and also importantly patient-reported outcome measures with quality of life questionnaires. So we have a fantastic team effort. Indeed, we have of course enrolled patients into the study, reflecting the number of patients that have attended our hospitals through this pandemic. We hope in some ways that we won't find any evidence of heart involvement, but on the other hand, if there is, this is something that our community does need to know about and would be informative to direct treatments to protect the heart should there be a case to do so. So the team is working ever so hard just now, and we've been pleased to share some of the de-identified images from the heart scans, and we hope that you will find these interesting. We've already published a paper in the journal Cardiovascular Research, which is a science paper from the European Society of Cardiology, and we're looking forward to submitting more manuscripts when the study comes to an end in 2021. So look out for the results of CISCO-19, and as Chief Investigator of this study, I'd just like to pass on my thanks to the patients who've taken part, their families who've supported them, and then of course our ever so hard working staff and the funders, the Chief Scientist Office. Thank you.